what is the craziest thing that's ever happened to you as a gastroenterologist?
Wow, the craziest thing that ever happened to me was many, many years ago. I was doing a flexible sigmoidoscopy on a lady, and a flexible sigmoidoscopy is a colonoscopy, but it's a short colonoscopy where we just put the scope in for several inches. And I got in there, and all of a sudden, all of these little white squiggly things about a half inch, like there were 20 or so, just moving around there. And it was the craziest thing because, with our endoscopy, it magnifies things 100-fold. So all of a sudden you see on the screen all of these worms just like going all around.
Ugh.
It was just like, you know, it was like something out of a horror movie. So, but it was instructed. It turned out to be pinworms. And, we've all heard about pinworms in children. Well, this was pinworms that happened to happen in an adult, current adult. And I got to see them in live in action, but certainly memorable
Oh my
and,
goodness.
and certainly crazy.
And certainly disgusting. Ew, that's why I'm not a GI doctor.
Yeah.
Yeah. Well, what is up, fam? It's Dr. Dale, and I am the host of Black Men and White Coast. This is the Black Men and White Coast podcast, where today, man, I am super excited. You guys don't even understand. This is a big episode for me because this guy's been a huge mentor for me for over 10 years now. And not just for me, but really a huge mentor for like a whole lot of doctors that came out of the Dallas, Texas area. So super excited. It's Dr. Byron Cryer. I'm not going to give you like all his accolades and all that stuff because we're going to talk about it here on this episode. So we're going to dive in. But before we do, remember to hit that subscribe button, right? So wherever the button is, hit that subscribe button, hit the like, hit the share. It's going to be a great episode, all right? So Dr. Cryer, man. So first of all, thank you for being on the podcast, Black Men and White Coast podcast.
Thanks for having me. It's great to see you again, Dale. When you were talking about greater than 10 years, I was wondering, like, when did we meet? When in your life did I come in? Did we cross paths?
Yeah, it was 2013. I was a first year fellow. First year fellow. First time I met you was at the first Heal meeting. It would have been like October 2013, I believe. So
Yeah.
it's crazy. It's 11
Well,
years now.
that was great. And, HEAL was a program that we were doing for residents. And you were a fellow at the time in pulmonary critical care and first or second year.
First year.
Some
I was brand new.
first year fellow. And we were trying to expose people and prepare them for careers in medicine. And look at you now. So I guess
It
it paid
worked.
off. It
The
worked.
program works. The program works. It's still working. All right, so let's dive into this podcast. I'm really excited about this. Just to kind of pick your brain. I know not a lot, but I know stuff about you just from over the years. But it's gonna be fun for me, kind of getting to know more about your upbringing and things like that. But let's start with this question. When you first became a full-fledged medical doctor and you got your long white coat, what was your welcome to medicine moment?
Wow. Well, so, in medicine, we finished medical school in May or June sometime, and I finished in June. And then you start on July 1st and you're like a real deal doctor. So I was an intern in the same place that I was a resident, Baylor College of Medicine in Houston. And so when you're a student, you have the luxury of not ultimately being responsible. So you're there, you're playing doctor, but you really don't have the responsibility. Well, typically, when you are a resident who was a student in the same institution, they don't hesitate putting you in hard rotations up front. So my first rotation, July 1st, I'm a big intern now, and I'm also on call, is in the CCU,
Hmm.
coronary care unit. So, I'm intern, I'm on call, it's me overnight, and the nurses. And I'm just sitting in my call room when they call me for a guy who's in tachycardia. So his heart is racing at 150 beats per minute. And they would call me as the doctor and like, okay, what do you want to do? I had no idea what, what to do. So I was just sitting there frozen, like, oh, like bringing out go get my notes, go get my book. But those days, we didn't have everything on phone. We had something called the Washington Manual, which was one of those kind of pocket books, like spiral, bound book that's about, I don't know, 4 inches by 6 inches, and you keep it in your pocket. So I'm sitting there like flipping pages, and the nurse sees me flipping pages. Well, the man, his pressure's going down, his pulse is 150, and so that's when I learned. And so my white coat moment was listen to the nurses. You can, when you're a new doctor, your best friend or your worst enemy can be the nurse. And so I looked up at the nurse, and the nurse started feeding me suggestions. Well, doctor, would you like to do this? Yeah, it sounds like a good idea.
That's what I
Let-
was thinking. I wanted to, yeah.
yeah, that's exactly what I wanted to do. Let's do that. And so she walked me through it. I mean, the nurses, if you think about it, certainly an ICU nurse, they've done this
Oh, yeah.
multiple times, hundreds of times over their career. So it was that whatever the nurse said was what I was going to do. And we got through fine. And that's when I learned that, bringing the nurses donuts, bringing them coffee, whatever they want. I learned that you really want to make great friends with the nurses. They can really make your life very pleasant, or if they don't like you, they can call you every half hour throughout the night and you never get any sleep. So that was my welcome to medicine, long white coat moment. I will say I was petrified, but I learned a lot and I grew a lot in those few hours overnight.
I love that. I love the nurse thing is 1,000% real, of course. But what I really like about it is I've seen you kind of watching you for the past 10 years. Is I've seen that same concept outside of the healthcare setting directly. The same concept of take care of people, be nice to people, take care of them, and they'll look out for you. So it's not just nurses, but it might be administrators or colleagues in general, things of that sort.
Oh no, that's just a concept I think applies in life. What comes around goes around. You do unto others as they'll do unto you. You know, you reap what you sow. So, in all of our interactions, whether it's in medicine or, as you say, outside of our career in medicine, it's just your path is a lot easier in life. Things go a lot more smoothly if you're nice to people and you get along with people. And you'll find people reciprocate. They'll recognize it just like you did just now, and they'll be more willing to help you out. And so I think that's one of the general life recommendations in terms of survival skills, especially if you're in that training phase or student phase. It will be a big payoff for you.
So let's I'm gonna take this general thing that I've not just me, anybody can pick up about you, and take it back to your childhood, so we can kind of go back in time here. You see, you're somebody who's got a lot of drive. And I remember you were at UT Southwestern, where
You
I
saying I
am.
am someone who has a lot of drive?
You are. I believe so.
Oh, you froze.
Yeah, I believe so.
Yeah.
And when you were at UT Southwestern, right before you transitioned over to be the chair over there at Baylor, um, one thing that I remember asking you was saying, like, hey, why keep going? Like, why keep going for these higher positions? And, I just saw you going to be vice president, I believe, of one of the gastroenterology societies. I'm like, why keep doing more? Why keep doing more? Like, you're successful in your career. You're good. You've got what you need, right? Where does that drive come from? Take it back to childhood. Is that something your parents put in you? Is that something that you were the kid always trying to be at the top?
Yeah, I think it definitely comes from my parents. So, it's interesting. So my parent, I have, there were five of us, and I am the oldest, and my parents actually chose our professions. And so,
Hmm.
they like one, two, for all five of us, they said, you are going to be this, you are going to be that. And so from as long as I can remember, maybe 3 or 4 years old, I remember I was going to be a doctor. And I actually have a picture of myself as a little kid, 4 years old, with my little plastic red doctor's bag, my red stethoscope around me, um, and these little fake red glasses that I had on for spectacles, because I guess doctors wear glasses, right? And so when you look back at that photo, it's like, okay, it was just like I was brainwashed from a very, very early age with this doctor's bag. So I remember that whenever I was asked what I was going to do, it was like, well, I'm going to be a doctor. I want to be a doctor. And so in my whole career of when you get to choose some classes in junior high school, it was all science classes. So it's like, well, I'm going to choose biology because I'm going to need to be a doctor. I chose a completely useless foreign language, which is Latin. Like, when will we use Latin in 2024? Right? Never.
Your medical words,
But
that's it.
right? But my dad said, you know what? You need to know Latin because a lot of the medical terminology is derived from Latin. So
Let
there
me
I was.
let me ask you this. So the hey, they would call you Byron. Hey Byron, you're gonna be a doctor. Was it kind of like, hey, you can be a doctor, you can be a doctor, or was it more like Joe Jackson, you're going to be a doctor?
It was the latter. It was, you were going to be a,
Really? That's
yeah.
fascinating.
And, so that, that, I guess it was just a command. It worked well. Every single one of us is doing, and as a profession, what we were told to do. And, and you think about it, you know, we could have, we could have been much worse off. And, I kind of a person that believes in, freedom of choice, personal choice. And I could have ultimately chosen what I wanted to do when I actually have a sense of what I inherently wanted to be. If I wasn't, told to be a doctor, and that would have been to be a teacher. And so this compromise of me ending up at the end of my training being a doctor in a medical school was a combination of what I was told to be and what I really wanted to be, which was a teacher. So I ended up being a teacher in a medical school. And as I think back on it, well, I ended up being a much better paid teacher than, than I would have been if I hadn't gone into medicine.
So
So,
are all you said there's five, there's five of you total, or you have five siblings, six or five of you total?
five total.
So are all five of all five of you went into that profession? Are all five of you happy with the profession?
Yes, and so yeah, we are, and yeah, I like what I do. I love what I do. If I actually think back on the the profession and ask when you ask yourself, okay, would I do this again? It's absolutely. And the thing, getting back to your question around, the drive, what I always say about kind of why a person has drive, or why they're motivated to do the things that they're into, is that they're fun. They like it. And so, like, if we think about our jobs as doctors, the reasons that we get up early, stay up late, work hard, is it's not work. It's fun. We look, so when you look at something and it's a hobby, or if you look at it and it's fun, you're going to be all into it. You're going to be jumping up early to go do it. And so that's how I approach my jobs now. Is that everything that I'm doing is, it's not toil. It's not work that is unpleasant. It's things that I like to do. I'm really into all of the projects that I'm doing. And when you say, well, what gives me that drive to go and do the next gig, the next task, it's that I think that they're fun. I'm interested in doing it, and so it doesn't really um, become work. And so, in terms of, like, what I recommend to people in terms of choosing their endeavors, I always say, follow your passion. Decide. So think a lot, take a few steps back, decide, what are you really passionate about? What do you really like? And go after it. And so if you go for something that you're passionate about, it's going to be fun. You're going to do it easily. You're going to do it well, and that's going to be obvious to people. So when you are passionate about what you do, other people see that, and that's recognized by other people as doing the job well. They're like, oh, that guy is really into the job that he's doing, and he's doing it well because he's passionate about it. Well, then that's your ticket to the next opportunity, and that's how opportunities come. People notice that you did one thing well. Let's say, I call it progressively larger circles. You so for example, in an academic medical center, we have divisions, departments, and then the big university. And what I always say is, start off within your own division. So you're a pulmonologist. Start off within pulmonary medicine and do something well within your division. That's going to be recognized. And then you go into the bigger circle, which is your department, internal medicine. Do that well. And then that's going to be recognized. And then you go to the next job, and that's going to be something at the university level. And so that's kind of what's been happening to me over the course of time. I didn't really have my career plotted out specifically in terms of and it's interesting. I knew I wanted to be a doctor, Ultimately, I got there. And then it's like, okay, now what? Well, there's all kinds of flavors of doctors, right? And so I wasn't really sure where I was going in terms of that ultimate type of doctor, but I was just doing it and doing what I enjoyed and followed the things that I liked and followed the things I was passionate about, and kind of where I ultimately landed as a doctor, that just sorted itself out because I was following the passion.
Nice. I love it. I'm still, because I'm the guy who wrote the book called How to Raise a Doctor, right? So I'm still on this idea that your parents said you were going to be a doctor, and
Right.
and let me ask another question about that. How did they? I know. Have you ever talked to them about how they decided what everybody would be? Like, why did they say you doctor, the next person this, next person that? Was it just because you're 4 years old? Is like if you just what is your rationale when you talk to them and say, hey, mom, dad, why did you guys do that?
Yeah.
That's
So,
what. That's my first question. My second question to follow up, what you can answer, is going to be: would you recommend that for, like, me? I've got my 3 children. Would you recommend that you say, "Hey, Dale, tell your kids you're going to be this"?
yeah. So when I talked to my dad about why, he was pretty clear in his mind. So he's a dentist, and his thought about it was, well, that's great. Being a dentist is a great career, but for him, he felt that it was physically hard. It
Hmm.
was hard on his back because they're always hunched over looking into someone's mouth. It was hard on his hands because they have to use their hands a great deal and pulling on teeth and things. And so he said, you know what? He wanted me to be a doctor that wasn't going to be so much physical exertion and so hard on a body as dentistry would, as his life was as a dentist. So he said, he wanted me to be a doctor, but not one that would not have a body that was beat down by the profession. So he said, be a physician. So that's as simple as that, how and why he chose this profession for me. And, I think in terms of choosing, so the question that you posed to me is choosing professions for your kids. Well, I'll say to that, you I could be a lot worse off than being a physician. And, I think it's always great to shoot high. So yeah, we're just going to assume that most people would think being a doctor is a high target in terms of ultimate professions. And I always say if you shoot high, even if you don't get to the goal, if you get to 90% of a goal of being a doctor, that's still pretty high. And so if you're a parent and you select, my recommendation is select high for the kid. And ultimately, if they get it, which, most likely they will, then that's fantastic. And if they come close, they're still doing very well. But I think it's really important to set goals and set goals high, because one of the things that you certainly have learned in your work with in Black Men and White Coats and all of the programs that you do for the younger people is, I'm sure you would agree, you advise people to set their goals high. And that's essentially what my parents were doing for us, and what they did for me was just pick a specific goal and put it high. And they know that your kids, and you just want them to reach their maximum potential. So you set a goal that you know that they can reach, that's feasible based upon what you've recognized in your kids, and set them out there and let them go.
So my next question, and the last question I ask about this topic just fascinates me, right? Because I do a lot of stuff around like, trying to figure out parents and kids. Um, why not just say all of you are going to be the same profession? Why not? You're all going to be doctors. I mean, he told you, you said since you were 4 years old, at 4 years old, it's hard to kind of know a child, what a child's
Mm.
potential really. So why not just say, hey, you're all going to be doctors?
It's an interesting question, and so I also think that what a parent can see is aptitude, and so if you think about kids, where they really excel is pretty apparent. You can see one that may be more inclined for tinkering with things like a doctor, or one might have a disposition that's closer to that of for example, a great orator, a great talker might be chosen to be a lawyer rather than a doctor. And you can see those characteristics early on in kids. And I think that's what my parents were also appreciating, is trying to kind of assess, well, what do we see as the strengths? And then you pick a profession that's aligned with the strengths.
That's so fascinating with me. I like it. I like the general concept of thinking that through. So I want to kind of fast forward two parts. Let me not go too far because I do want to know what kind of like high school teenager person you were, because I the Dr. Cryer I know was well polished, professional, executive presence, but certainly you weren't like that your whole life. I don't think. I don't know. I could be wrong, but certainly you weren't like that your whole life. I think, did you grew up in Miami area? Is that right?
I did.
Because I remember one day I was like sitting down somewhere and I just heard you out of nowhere start speaking Spanish to somebody. I was like, I did not know you could speak Spanish. Like, oh yeah, Miami. So what were those younger Miami days like for you? What type of high schooler or teenager kid were you? Were you just a book kid, the sports, or were you out there salsa dancing, or what kind of kid were you?
Certainly not the salsa dancing. So we I actually had a very, I think, unusual upbringing compared to the typical kid in the US. So the first place we landed in Florida, in the state of Florida, was the southernmost point in the United States. The southernmost point in the United States, for the trivia buffs, is a little island
Key
called
West.
Key West, Florida. It's 90 miles from Cuba. So
Wait,
that's
wait,
where,
you said the first place you landed. So where were you before there?
well, well, we were, I was born in Chicago. And I was born when my father was a student. And so, as you know, kind of in our business, Dale, we
Mm.
have to jump around, from your college to your medical school to your residency. So and so it's kind of like the military. Like if you are being raised by parents who are in the early phases of their physician training, you jump around. So um, my dad was carting us around to the various places that he was being trained. And so in his situation, the U.S. government paid for his education. The deal he had was, in exchange of them having paid for his education, that he would need to be sent to a medically underserved area for service. So he needed, year for year, for every year they paid for his education, he had to give back an year in service. And so we were sent to a medically underserved region, which was called Key West, Florida, which is a little island that is basically paradise. But the reality is that there are few medical professionals. They didn't have dentists, they didn't have doctors. And so I didn't know. I was just a kid. But that's where I grew up. And so school initially was going to school. And my school actually was like in a trailer, because also they didn't really have, well, a strong educational infrastructure. But nevertheless, go to school. And then after school was the beach. And so that I didn't realize that that was not like normal. But your world and what you know is normal to you as a kid, and so that was my normal.
I've been to
So
I've been to Key West once, and the thing that comes to mind is a whole bunch of chickens running around everywhere.
yeah, there were also chickens. You're absolutely right. There was not, a very developed place, but it was fun. And you make the best of the situation. So we were there for elementary school, and then we moved up the street, 4 miles up the street to Miami, which is where I went to junior high and to high school.
That's Highway One, right? Is it Highway Interstate One? Okay.
Interstate 1, it will take you from all the way from Key West, Florida up to Maine. But yeah, so it's a Highway 1 that you can take to that we took to go up to Miami. That's where I went to high school. Um, in terms of the high school, I, was privileged to be able to go to private schools. So I had a leg up there it, with my education, and so it was a good experience. I would characterize myself, if I when I think back at it, as a nerd um, for in high school. Um, and my sport, which you would never guess, was
Tennis.
wrestling. Nope,
Oh,
I was a
Does- uh,
wrestler.
but don't you play tennis?
Oh, I play at tennis.
Now that you say wrestling, I can actually imagine that. Now that you
Yeah,
say it,
yeah. So that's what I did in high school as my sport, and I actually was pretty good at it. And so I ended up being third in the state of Florida,
oh
so the
wow.
entire state
So how does
for
a third place wrestler in the entire state consider himself a nerd? How are you a state top state
wrestling.
athlete and a nerd?
Now the nerd part was the part of really being into chemistry and into the biology and liking to do the frog dissections. Um, but at the same time, I was a pretty good wrestler. And so, but
From the nerd, I don't know if this is what people call nerd, but socially, were you in the in crowd or not or average?
yeah. So I guess when I think back on it, I probably was on the in crowd because I ended up being the student body president.
You
Uh,
definitely were not a nerd.
right. So I I guess I was socially good. I mean, because I think when you think about people who are politicians, and I never thought of myself as a politician, but when I look back in high school, I guess I was since I was the president. Um, Most of that takes social skills to just be able to get along with people and convince people to follow you. So I guess I did and this is the first time in this conversation that we're having now. I guess as I look back on it, I guess I did have leadership skills back then um, because of having been selected as president. But that was fun to do, and um, that was also kind of one of the early kind of learning experiences on how to lead people, how to run meetings, how to organize people behind um, some concept. So yeah, I did that.
It's
As I think I never really saw myself as a politician, still don't. But as you just mentioned to your listeners, here I am about to embark on being another type of president. So I've been a president very early on in the career and all the way through at various stages. But yeah,
I'll tell
but
you
what's that?
something pertinent because the hope is that we know a lot of young black individuals, not black but individuals across the board are into sports in high school. So I'm glad that you talked about being a wrestler and being a very good wrestler, third in state. Because something that I'm starting to see more and more is a lot of these top athletes actually do very well academically also nowadays. I feel like when I was growing up, that wasn't the case. But now I look at there's a guy who went to, from this area where I'm at. He went to MB and he always had a 4.0 GPA. One of the better high school kids in the area around here. I saw him post online. He had a 4.0 GPA. So nowadays it seems like the sports kids are starting to hopefully take academics more seriously and get more into it. And that's what you had way back when you were in high school. But I don't think that was commonplace back then. But it almost seems more commonplace today.
I would agree, but if you think about, you know, especially the top tier athletes, it takes a lot of mental acuity to be at the top of your game. in terms of your concentration
That's true.
and your planning and your execution. And so it's the same sorts of kind of thought processes that we go through as doctors, um, drafting out a plan, executing that plan, and being successful at it. But it's just rather than doing that in medicine, they're doing that in basketball or baseball or football. So yeah, can think of. I agree with you. I can think of several examples of professional athletes who are also pretty smart, pretty book smart. So I don't think that they're mutually exclusive, and it's not a it's not a either or. I absolutely agree about with that.
So, okay, high school, the nerd who happens to be number three in state wrestling, the class president, and all that, then decides to go to Harvard. Tell us about that decision. Was it why Harvard? Could there have been any other places you were looking at? Like, I don't know why Harvard. Obviously, Harvard top college, but just what was the thought process there? And then, of course, I want to know what was your time like at Harvard as a black man.
So, um, why Harvard? That is going to be attributed to the role of the high school counselor. So I grew up in the South in Florida, and my idea of the pinnacle of success of where I wanted to go to college, where Harvard was not even in on my radar screen. Where I wanted to go was Emory, so I wanted to go up north to Atlanta and go to college there. And that's like everyone that many people that I had known who I considered to be real success stories were going to um, Emory. The other place that would have been my dream school would have been also in the South. Tulane was also on the list. And so when I went in to talk to the guidance counselor about college plans, when I told her where I wanted to go, she was the one who planted the Harvard thing in my head. She was like, "No, have you thought about Harvard?" Well, no. Well, I think you should apply. Well, okay. So I did. Just because, just like my dad told me to be a doctor, the counselor said apply to Harvard. So I guess I also follow rules, follow uh,
Uh,
follow commands, and so I did, and it worked out.
yeah, something. I guess something to be said about that when you have people around you that you trust, giving you good guidance. Because obviously, certainly, like I've got a big leg up from stuff that you've gotten me through over the years. So when you have people that you trust to give you that, you learn that early to be willing to listen to people and accept, just good instruction. Really.
Yeah. So the big decision was that and you're familiar, I'm sure several of your listeners are also familiar with these combined undergraduate MD programs, and so I applied to four regular um, undergraduate programs and then two MBA bachelor's MD programs, so truncated for 7 years. So, the 8 years of 4 years in college and 4 years in medical school would have been done in seven, and you were coming out of high school, were accepted into a program that would be a automatic path to the MD. So, like if you're thinking about gambling, the sure thing is getting that 7 year program out of high school. So I've received two of those, but I ultimately decided to not do it. And if you're just going to a 4 year college, that's not a guarantee at medical school, but that's what I wanted to do. I wanted to know something outside of science. So, like, if you take one of these truncated programs where you're combined bachelor's and MD, pretty much your whole experience is going to be science. And what I knew was that I was going to be spending the rest of my career focused in science, but I also viewed college as an opportunity to learn other things, and probably my last opportunity to really where in a real dedicated fashion have time to learn things that aren't science. So I chose to go, that's why I chose to go to a 4 year liberal arts college. I went to, my major in college was biology, but I studied lots of other things too.
I,
Um,
I, I love that concept, what you just said. And you mentioned college would be the last opportunity, or could be the last opportunity to kind of learn other things. I remember I went to college with my wife, my now wife. Um, I remember I would tell her that exact thing all the time, specifically as it pertained to not learning other things outside of science, but pertain to learning things within science, like physics. I remember being in physics lab, and my wife, she hated physics lab. But I'll tell her, say, Janae, this is the last time you're gonna get to go around and just bang stuff and throw stuff, or chemistry. This is the last time you're gonna get to like just mix up random chemicals. And I think for the college listeners and the high school listeners, that's a huge thing to consider, right? Like enjoy your college experience, your not just the fun and the parties, but the learning opportunities in college, because you don't get those opportunities after you leave college.
no, you don't. It's a college is kind of the last frontier of broad learning and parties and having fun while learning. Medical school is real different, as you well know. Medical school is a whole different level of studying and a whole different pace than college was. College was great.
But
Um,
no, I want to get to the fast forward to that, but the time at Harvard. So how was that for you? Was it because from those of us who, I guess I spent the summer at Harvard, so I got to see kind of stuff. But most of us who didn't have that real Harvard experience, Harvard is something from the outside looking in, like, oh, Harvard, right? So your time at Harvard, can you kind of let us outsiders know, what does that look like on the inside?
the thing, it was a great growing experience. So the thing that's really unique, one of the unique things about Harvard is they are very, very deliberate in picking students from all over the world.
Hmm.
And so they are proud that they have students represented from all of the 50 states. So not only will you get to know these kids from Alaska and Hawaii and Montana and places that you may never go, and but there were Russians, Germans, uh, people, Chinese, people from really all over the world who were there. And so where I grew and what I thought was one of the greatest growing opportunities was learning from my classmates and mostly learning from their life experiences and learning from their differences. And so what I think one of the real unique places of a true melting pot like Harvard is that you take these young adults from all over the world and you put them together and they think differently and they've had different backgrounds and different perspectives on an approach to a problem and you put them all in the same environment and say figure it out. One gets out of diversity, right? So you had an extremely diverse pool of students who were all fairly good students and um, probably fairly smart students. And you say, get into this community and grow and learn together. And I learned as much from my classmates about things outside of the classroom um, as I did within the class. And as I'm kind of thinking back on it now, that was a really good example of the value of having diversity, diverse perspectives, and it was a great learning opportunity. So those 4 years that I was there was probably the equivalent of 10 to 15 years of maturation, 10 to 15 years of growing. I was this kid who had spent, much of his life on an island that was 2 miles by 4 miles, right, on the southernmost point of the United States, and ultimately got thrown in to this pool so in any one class there were 1,600 per class. So 1,600, or for the four classes, 6,400 people from all over the world. and I really grew and I really learned.
Mhm. That's fascinating, and it's one of those things. I think whenever people are sending your kids off to college, that's probably. I mean, some people think about it, but I imagine a lot of people don't even really think about that part of it. They just think, what are the academics like? What are the grades? Will they get into medical school? Da 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 da. But they don't realize there's actually data on things like what you're talking about in terms of the diversity of the student body and how much that actually contributes to the outcome on the backside. Let's fast forward. So I don't want to run out of your time. Let's fast forward to I'm gonna skip kind of the med school, all the detail stuff, but the part I do want to get in the med school is why GI, why gastroenterology? What was special about that calling for you? Because you got people like me who are like, I'm not trying to be down there. I'm not trying to deal. You started this episode up by talking about pinworms. Like I don't want to deal with any of that. All right. So
Right.
yeah, why GI? What was that calling for?
Yeah, so so I alluded to a little bit earlier. For me, it's always just been about the next step. Like, okay, let me get to the next test, the next 6 weeks, the next whatever. So, and it was very much like that in medical school. So when I went to medical school, I had no idea what kind of doctor I was going to be. Didn't really think about it much. It was always just knocking out that next test and moving on to the next challenge. So I was just walking through medical school, not really thinking about the future. It was just real, all very much short term. And the story I'm going to tell you points out the value of role modeling. And so I chose gastroenterology because of a role model. So I was, medical school, we spend our first year and a half, some places 2 years in the classroom, just learning science and medicine. And then the second 2.5 years, 2 to 2.5 years of medical school is in the clinics and the hospitals. So I had been in medical school for about a year and 2 months and sitting in these lecture halls, and never in that year and 2 months did I see zero professors of color,
Hmm.
specifically African American. So when we hit the first year of medical school,
And this
you
is
learn
in
about
Houston. This is in Houston, Texas.
in Houston, Texas, Baylor College of Medicine. So um, the first year is just spent learning about normal processes. The second year, you learn about disease processes, and we learn about the disease processes by disease system. So it was um, January, and we were learning about the digestive system. And so the people who were teaching us about the digestive system were gastroenterologists. So, and when you learn about the lungs, the pulmonologists came and gave you those lectures. Learned about GI, the gastroenterologists were coming. So I'm sitting there in the classroom, and it was like an amphitheater classroom. And I noticed we were waiting for the lecture to start, there was this African American man who walked from the back of the room, and he was walking down towards the front of the room as if he was going down there to give a lecture. And in fact, he kept walking, and he went up to the lectern and started talking. And that's when it caught my attention, because I got sat straight up. I was like, okay, I've been here sitting through all these classes for almost 2 years. And I've never seen anybody black come up here and give me a lecture. And so I listened to what he had to say, and he was showing us his endoscopies and like what they do with the scopes. And I'll say two things. One was, when I was a kid, I always liked this movie called A Fantastic Voyage, where the people miniaturize themselves and they travel throughout the body. And so when Dr. Sutton was his name, was showing us the pictures of what endoscopy looks like inside the body, it took me back to my childhood, where I was thinking about being miniaturized and traveling throughout the body. Because as you know, with an endoscope, it magnifies things many fold, and you are basically in there with the scope traveling throughout. So that concept really resonated to me, one. But two, and more importantly, I said to myself, well, you know, they let him in to gastroenterology. He was able to do it. Well, I'm going to do that too. And it was as simple as that. So between
Wow.
from 8 o'clock to
Well,
9 o'clock, I made a life's decision. on what I was going to do exclusively by the basis of a role model. And he had no idea that just his presence in that classroom was influencing people's career choices. But that's exactly what happened. And it was in less than 50 minutes, I decided that that's what I was going to do because he was doing it. And I hadn't seen any other doctors in that medical school who were African American. So that's why.
That's such a powerful thing. We had a previous podcast in the past, I think it was Dr. Aaron Palmer, he's a neurosurgeon. Very similar thing he mentioned, but his was just to become a doctor. He was like, well, I believe it was something like, well, I saw this guy, he was a doctor, and it had nothing to do with what he did as in medicine. It just had to do more with his presence as a doctor. And I said, hey, I want to be a doctor too, just based on seeing the guy. Um, I love it. I love it. Important stuff. So okay, fast forward and you leave Baylor, you come to Southwestern, you do your GI fellowship here, become an amazing, renowned gastroenterologist. I remember when I came to Southwestern in my early days, I looked people up, looking up and see you on like C-SPAN or something. You were tested by, you were something, doing something big on a national level. I remember seeing that, be like, oh my goodness, he's the guy, he's doing all this stuff. And the GI part is great. But then the leadership, you talked about these growing circles and circles and circles. And one thing that's important for the viewers to understand is, you've had a lot of associate dean roles, or maybe at least two that I know of, right? And then you moved on to be essentially the equivalent of chairman. But the amount of people you've touched in Dallas, if you talk to anybody who trained in Dallas, any minority essentially, yeah, Byron Cryer, the amount of people you touched, tell me, like, what is that legacy you're looking to leave? Or tell me more about that, because so many people have been impacted by all the stuff that you've done, and people are being impacted by, they don't even realize you're impacted by the foundations that you laid, decades ago or 10, 20 years ago.
Yeah, so for us, once you've made it through the various levels of your career, so like in academic medicine, it's very kind of regimented: instructor, assistant professor, associate professor, full professor. So you make it to the top. Then what is the next thing to be accomplished? You've had all of those successes, and so once you get to the top, what becomes important is giving back. And I think it's a concept that um, all of us should be doing and giving back in one way or the other. And so now, what then becomes important to you once you've achieved is what you can do in terms of giving back to others, in terms of mentoring and developing the next generation. And so my focus throughout my career had been giving back, because none of us got to where we were, or where we are, without the assistance of others. And so it's really important to recognize that and make sure you give back, pay it forward, as people say. And now what's important to me is making sure that the next generation is well positioned to take the baton and to keep going. And so once you've made it to the top, I think how you can continue to contribute is making sure that you pull other people up, and that the people who are going to be taking care of me as my doctors are well situated. And so right now, what's important to me is the legacy of establishing the next generation. You mentioned that I'm in 2 years will be the president of the American Gastroenterological Association, and that's a position you have to apply for and be selected. And in my platform for applying for that position, what I ran on was the next generation. And I want that professional association to be preparing the next generation of gastroenterologists to take us to the next phase. And so, really, everything that I've been thinking about in all of these associate dean roles. And so, as you mentioned, I started out with medical students. So, and most of those medical students, not all of those medical students who I started out with, they're all doctors, practicing doctors now in some capacity or another. That's a good feeling to know that you were a part of their development, and now they're out there doing their thing. And so now at the level of for established physicians, so that's when I met you, right? So we were doing faculty development. So it's the same thing, developing the older than students, but now let's develop these men and women for the next generations of physician leaders. Same thing I'm doing in my job as chairman of medicine now. Same thing that I hope to be doing in my job leading the Gastroenterological Association.
I love that. I love that. And we'll wrap up here in a second, but I definitely want to give Dr. Cryer his flowers and say thank you. So I know we didn't get into HEAL too much, but HEAL was a initiative that Dr. Cryer started back in 2013, and I mean I won't dive into what it's about, but essentially it's about kind of preparing now residents and fellows for just careers in medicine, more specifically now kind of careers in academic medicine. Phenomenal program. And I joined that program. One of my friends, Queenie, saw me in the hallway one day. She's like, "Hey, Dale, there's this thing, after we get off of work at 5, and there's gonna be food there." Like, "Oh, sure, okay, I'll be there." So I show up there, and then I see Dr. Cryer talking. I'm like, similar to what you just described about the role model, GI role model that you saw. I see Dr. Cryer talking. He's got the presence, and clearly knows what he's talking about. So I said, I've got to go introduce myself and started going to the HEAL meetings. And as soon as I graduated fellowship, Dr. Cryer gave me the opportunity to have a leadership role in that HEAL program as, junior faculty from day one of being faculty. And that's been instrumental in just my growth as a professional. I would say my growth as a professional. Kind of me summarizing a lot of what I'm hearing from you is you've always had a plan in place your whole life. You've always had a pathway kind of there for you your whole life. And that pathway to me almost seems like it was a safety net, starting with your parents saying you're going to go down this medicine pathway to getting plugged into the medicine pathway, which has here's the step, the next step, the next step. So that was kind of like a safety net that you had. And within that pathway, you had the liberty to move around and to find your passions and to develop it. I would just take that next step. But a big part of that success is kind of having that pathway already set. Is that accurate?
Yeah, absolutely. I think, it's easier when you have a plan. What pathways is just a plan, right? And the way that I've always conducted my life and in all the advice and mentoring I do is to say, decide what the goal is. And then once you know what the goal is, we can work out the plan for how the steps of what you need to take to get to the goal. It's easy. So, but first you look way downstream, you say what the goal is, and then you back it up and say, okay, here's the plan that you need to pursue to get to the goal, and then just do it one step at a time and following the plan. It's easy. So that's pretty much how I've conducted my life, and it's the same sort of advice that I give to everyone else.
Yeah, I remember when I was, again, right when I became faculty, I remember you called me to your office, we sat down, he started telling me about, okay, Dale, promotion, do this, do that, and you laid the plan out from day one. That journey was very important. So let's wrap up with two things. The first thing is I'm going to ask you to give your final piece of advice, take home message to the listener.
It's just what I think I would like to end with what I just said, which is two things. One, follow your passion. So spend some time of really, really digging deep down and deciding what moves you, what do you really, really like, and do that, follow that, because it will become easy because your passion is something that you're going to pursue effortlessly and it's going to seem fun. So identify your passion. And then the second is identify the goal. So if you know what that passion is, what's the end goal of all of that passion? Where are you going to end up? And then just define what the goal is, and then go to someone who can give you some advice as to what the pathway should be to getting to the goal. There are lots of people out there, lots of resources for advice, but those people who are going to give you the advice are going to be best assisted by you knowing what the goal is.
Love it. All right, so to the listeners, real quick. So I'm gonna tell you two things real fast, and I'm gonna let Dr. Cryer wrap it up. by saying something here in a second. But to the listeners, so what's going to happen right about now is YouTube's going to show you some videos around here, showing you these videos because it believes that you will like this. YouTube's got your data. YouTube knows what you like to watch. So click on the video. You're going to enjoy it. You're going to grow from it. That's number one. Number two is hit that subscribe button, right? So we're really trying to grow this podcast, grow the channel so we can get these out to more people, impact more lives. So hit that subscribe button. And now, Dr. Cryer, I would like to offer you the opportunity to end this episode by looking into the camera and saying, my name is Dr. Byron Cryer, and I am a black man in a white coat.
I am Dr. Byron Cryer, and I'm a black man in a white coat.
Stop playing around. Really got them racks, ain't playing around.